Let's have a little orientation session here about how do we go through a tomosynthetic image from front to back or back to front, lingual to facial, facial to lingual. Just a reminder that this 10.5 millimeters, what you see here, is in relation to distance to the detector. If we go as facial as we can, we see this 15 millimeters away from the detector. Now, one of the key factors to remember in looking at tomosynthetic images is not that everything that's in the image is always in focus. For instance, let's look at this root here. Looking at the root, we see a nice periodontal ligament space. You can see some internal resorption here, possibly caries, we don't know. It looks more like internal resorption. But you see these other roots are not really in focus. Well, that's because the second molar is in a different position than the first molar. But as we scroll through, we can see more of this distal root. And you can see the periodontal ligament space here. And just to remind you, can enhance these images, and that gives you thinner slices to go through. This may be an option that you might want to consider in looking at the tomosynthetic images. Just to kind of review, the second molar is in a different position, so we wouldn't expect the second molar images to all be in focus along with the first molar images. So we'll go back to the most facial extent. Here is our periodontal ligament space in this area of either caries or internal resorption. And so now we're scrolling toward the detector. And so you see we've lost some of the definition here of the periodontal ligament space as well as this lesion, but we pick up the periodontal ligament space and more of the pulp as well as the lamina dura in this distal root. And you can see the same thing with the pulp here. Now, also notice that as we go more lingual, we're picking up more of the mesial root. Lamina dura can be seen. We go back over to the first molar. Now it's difficult to visualize the root, but again, that's because they're in different positions in space. And these slices are all parallel to the detector, not to the tooth surface, so to speak, because the teeth, different positions, some of them are curved surfaces. We continue to scroll, and now we can see the distal root better, and then we can scroll all the way through back to the closest to the detector. Now, some of these images at the very limit toward the detector and away from the detector are going to have more of this blurring. But you can see as I'm scrolling through, now we get a better idea of the bone level here. Not so much on this tooth, but as I scroll forward, you can see how the periodontal ligament space is more visible. You can see the trabecular bone is a little more clear. It's basically learning how to scroll through an image, keeping in mind that the images you're looking at on screen are parallel to the detector. And so as you're moving through the teeth, some parts are going to be in focus, other parts are not. You can also change things a little bit by contrast and brightness, or using the gamma, which one finger is on the control, the other is scrolling. You can lighten the image a little bit with the gamma. You can see a little bit more periodontal detail that way. Or you can make it a little bit darker where caries becomes a little more evident. Or you might want to think about using the gamma to more balance your images. That's a general orientation. And I think we'll go to another image and see a few more things. I'm going to, again, hit the metal artifact reduction. Let's see what this looks like in a synthetic 2D. This is more like a two-dimensional image your standard X-ray technology would give you. And we can see there's bone levels here. This is a very good, just basic two-dimensional image. We go now to the tomosynthesis. And again, we're at the facial surface. And as we scroll through, now notice how the periodontal ligament space, again, is very well defined on this tooth, on the first premolar. Now we see it's well defined on the second premolar. We notice a little hypersegmentosis here. But you can see the lamina dura is clear, the periodontal ligament space. As we continue to scroll, now we see large vertical defects, which, if we go to our synthetic, are invisible. So we go to the tomosynthesis, they're visible. And if we go to enhance, once again, to have thinner images, I'm going to make this a little bit lighter because now I'm looking at some periodontal structures, and notice as I'm using the gamma, you can see more bone here and here. Or you can use brightness and contrast as well. But let's take a look at this. We see deep vertical defects along this mesial root. As we continue to scroll toward the detector, you can see more detail. Now it disappears, so you have a kind of a three-dimensional idea of where this lesion is. And notice now the distal root becomes more in focus, whereas everything else is pretty much out of focus. But again, we're looking at the distal root. You can see actually several canals here rather than one. There's one canal, there's another canal. They probably join somewhere here. So it's just a matter of training your eye and your mind to imagine that these slices are going to be parallel to the detector, and you're going through surfaces that are at different positions in three-dimensional space. This is an excellent example of how you can use this tomosynthesis image to discover defects that would be invisible on two-dimensional radiographs. And so now we're scrolling more toward the facial, and we can see again the first premolar. As we go more toward the lingual, we can see the second premolar and now the first molar. So it's a matter of training your eye and mind to realize you're going through three-dimensional space with a flat surface of resolution. Let's take a look at another one. This will be an anterior projection, and I'm going to again start with a synthetic image. So this looks like a very nice synthetic image, 2D image. It's very similar to what you get out of a traditional system. And just parenthetical remarks, these are lines up here. They're not really to be worried about or be concerned about. They as part of the tomosynthetic process. These represent the different layers. All right, so this is what we can see with a two-dimensional image, and this patient complained of sort of an abscess or lesion between tooth 8 and 9. Now we notice that tooth 8 has a root canal filling, and anytime you do a root canal, the tooth is more susceptible to fracture. So let's take a look at this image in the tomosynthesis. We'll put on our metal artifact reduction. And already, here at this point, we can see what possibly may be a fracture line. And I'm going to do the enhancement again and show a few other features of this lesion. Now we know that where fractures occur, and if there's an infection in the area, which are much more likely with fractures, generally the fracture will point to an area of bone loss. So we should expect to see loss of lamina dura, maybe loss of trabecular bone. And so as we scroll through, now we see this fracture here, and you can see it goes all the way to the gutta percha. And notice the lamina dura. I'm tracing it with the cursor. It stops here. If you notice on tooth 9, it goes all the way to the alveolar crest. Well, the reason it stops is because of this region, which has some bone loss associated with it. Now I'm going to use the zoom function, and you can see there's a defect here. There's loss of bone, the lamina dura here, and some loss of trabecular bone. And this is the source of the abscess or the infection. You can also see that this fracture extends here and then all the way to here. So that's the reason the patient had the problem. This is another good example of why the tomosynthetic images can give you more information, because you're going through layer by layer and you can see more than, as you can see with a two-dimensional image. And again, look at the periodontal ligament space. Everything's in focus. But then as we continue to scroll toward the detector, now you can see number 7, periodontal ligament space is visible. Then we have number 9, which is here. You can see the outline of that tooth very well. And even on tooth 10 over here. So again, it's a matter of training your mind and your eye to thinking that these are parallel images to the detector going through teeth that are in different positions and also have different shapes. There's some curvature to these as well. Let's go to a maxillary molar periapical. That tends to be the region where we see more what we might call geometric errors, where it's very difficult to see in that area, of course, and we see a lot more overlaps. There are also some other concerns. So let's go to maxillary molar area. There's more bone back here, so to speak, and occasionally you'll have an image that is underexposed. This is an example of one. You might notice that the images are a little bit grainy. Not too bad, but they're a little bit on the grainy side, and what that means, they're underexposed. In digital imaging, if you overexpose, it might be a little bit darker, but if you underexpose, it isn't lighter, say, in the case with film. What it is, it gets to be a little grainy. Now, think about when it rains. First raining, you look at the sidewalk or the street, and you see they're just splotches of water. That's being underexposed, but you get more rain, and then it becomes more smooth. So it's certainly a good idea to set the exposure levels higher if you're in the posterior, certainly higher than your anterior projections would be. The other thing about the molar area, particularly with the maxilla, is the beam angulation. Now, if you notice, I'm going to go to the synthetic mode, and I can scroll and open up maybe this more distal contact here of the second premolar, but I can't open up these others between the first and second molars. And one reason is the imaging geometry to start with wasn't very good. So this ability to open the contacts has its limitations. Basically, you have to use the same imaging techniques and principles to get the best image possible with as few overlaps. Yes, you can correct for some of that by scrolling the synthetic image or going back to the tomosynthesis image and scroll, but basically it's the old principle that if you start off with a big error, you can only correct so much of it. And that's important to keep in mind, particularly when you're looking in the molar region. So a little bit higher exposure and using your same imaging principles that you all learned in your training, that the beam should be at right angles to the detector. Now, this area between the first and second molar, you might remember the contact is different than all these others. It tends to go in a slightly different direction, which is why this can be a bit of a problem. But I think that would be overcome here in most cases, except there's just too much angulation error to begin with in this particular image. So underexposed angulation errors is going to leave you with a less than optimal tomosynthetic image. So that's an overview of how to best view tomosynthetic images, keeping in mind that you have to train yourself to look at images where portions are blurred but portions are also in focus. If you think of it as maybe depth of field in a camera, that you can change the depth of field where things in the background are in focus but in the foreground are not, and then vice versa. It's a very similar concept.